The journey from being a nursing student to an actual professional nurse can be downright overwhelming. So to help you navigate this critical phase, we've compiled a list of essential tips for new graduate nurses. By following these guidelines, you can ensure a strong foundation in your nursing career. So number one at the top of the list is to seek mentorship. Honestly, I wish I would have done this sooner in my nursing career. Finding a mentor who can help guide you through your early stages of your nursing career is invaluable. It's as simple as reaching out to experienced nurses or even nurse leaders in your workplace and ask if they would be willing to mentor you. They can provide advice, support, and even share their wealth of knowledge, helping you grow both personally and professionally. And quite honestly, you'll be surprised at the willingness of other successful people willing to help you. Because at first, I was thinking that I would be a burden to the mentor, but finding that one right person can change everything. Number two is critical: embracing lifelong learning. Nursing is a dynamic field constantly evolving with new research, technology, not to mention AI, and even best practices. So staying current with evidence-based practice by pursuing continuing education opportunities, even attending conferences, or joining professional nursing organizations. This commitment to lifelong learning will keep you updated and enhance your nursing skills. So the best way to do this is simply to stay curious. Don't think that extra learning is a waste of time or a burden. If you stay curious, it won't feel like work. Next is number three, developing effective communication skills. Now this one is huge. Effective communication is vital in nursing, where you have to work as a team. So you can strengthen your communication skills to ensure clear and concise interactions with patients, families, and even colleagues. The big thing here about communication is actually practicing active listening and learning to be empathetic and understanding and ask questions when necessary. Remember, clear communication fosters trust, it promotes collaboration, and it improves patient outcomes. Next is number four, prioritize self-care. Now, we talk about this a lot in the new grad course, but remember, nursing is demanding both physically and emotionally. So to provide quality care to your patients, you must first take care of yourself. I always had a mentor that said you have to fill up your own cup first before you can pour it in to other patients. So practice self-care regularly. You can do this by exercising, getting enough restful sleep, eating nutritious meals and not that garbage, and even engaging in activities that bring you joy and relaxation. So remember, you can't pour from an empty cup. Fill up your cup first before you pour it out into others. Number five is to embrace critical thinking. Remember, critical thinking is an essential skill for nurses. It involves analyzing situations, evaluating evidence, and making informed decisions. So you can cultivate your critical thinking abilities very simply, either by asking questions, seeking different perspectives, or reflecting on your own experiences. This skill will help you provide safe and effective patient care. Next is being open to feedback. Remember, all we're doing in nursing is learning. You're a lifelong learner. So think about constructive criticism as valuable for your growth as a nurse. Honestly, I'd recommend to actively seek feedback from experienced colleagues and use it to improve your skills. The big focus in nursing is simply just to get better and better each and every shift. Next is number seven, cultivate empathy and compassion. Show genuine empathy and compassion toward your patients. Now, honestly, this goes without being said, but it's really difficult to do that in stressful situations. So just remember to treat each person as an individual, considering their unique needs and circumstances. Number eight is to stay current on evidence-based practice. So always keep up to date with the latest research and evidence-based guidelines in nursing. Now this goes a long way in the ICU. We interviewed an ICU nurse, Nurse Lauren, who said that she always had to dig into research papers and really be up to date if she wanted to work in the CV ICU. And so that was one of the biggest takeaways. So if you plan to go into the ICU, you always want to incorporate evidence-based practice into your clinical decision-making. And it'll set you up with more knowledge for wherever your career takes you. Number nine is embracing cultural competence. So obviously, we want to respect and value diversity from your patients. Learn about different cultures, beliefs, and even practices to provide culturally sensitive care. You can even learn a few words in that language to make your patients feel more comfortable. Now, number 10 is to advocate for your patients. Remember, you as the nurse are their voice. So being their voice when necessary is crucial. Advocate for their needs, their rights, and even their safety. This includes ensuring they receive appropriate care and are involved in their own healthcare decisions. Number 11 is continuously refining your nursing skills, almost like sharpening a blade. So I always encourage students to regularly revisit foundational nursing skills, such as wound care, medication administration, even vital signs to maintain proficiency. I've met so many nurses that specialize in one area and end up losing their skills. So quick refreshers are always recommended. Number 12 is to reflect on your practice. So always take time to reflect on your experiences and what you've learned from them. Reflective practice promotes self-growth and helps you to identify areas for improvements. Next is number 13. It's recommended to familiarize yourself with nursing standards, regulations, and even policies relevant to your practice area. So this includes understanding legal and ethical frameworks. Now, honestly, that'll go a long way if you plan to be a nurse practitioner or even a CRNA, because laws are constantly changing around their scope of practice. Number 14 is about attending continuing education programs. So participating in workshops, seminars, and even conferences to expand your knowledge and stay informed about the latest advancements in nursing. Second to last, number 15, is to develop a strong work-life balance. So remember, it's easy for you to lose yourself in the nursing career, especially as a new grad. You want to be sure to prioritize activities outside of work that bring you joy and fulfillment. Maintaining a healthy work-life balance is crucial for your overall well-being. But again, as a new grad, it's going to take you time to learn this. So give yourself grace for that first 6 to 12 months. And last but not least is number 16. You want to be able to celebrate your achievements. Guys, you've passed the NCLEX, you passed nursing school, and a few years ago, you were just praying to be right here where you are now. So recognizing and celebrating your accomplishments, no matter how big or how small. Nursing can be challenging, so acknowledging your success will help you stay motivated and positive. Now, if you're watching this as a new graduate nurse, or simply want a more in-depth look at these topics, well, we've actually partnered with Elite Learning to create a new grad mastery class. And this class covers everything you'll need to know for a successful transition from nursing school to finding and working in your first nursing job. So in this course, I and other nursing experts have put together some helpful tips and vital essentials for you as a new grad. So let me show you a behind-the-scenes peek. Number 1 is interview tips and resume builders to help you land your dream job. Number 2 is skill refresher videos right on your phone when you need a quick reference. And this comes in super handy in the clinical setting, especially when you're new to a unit. For example, let's just say the doctor ordered a Foley catheter, and maybe you've never put in a Foley on a live patient, and you completely forgot the steps. Simply pull up your phone and watch a quick refresher video. We also have videos about expert strategies for conquering new job anxiety, which will always be there. Oh, and last but not least, you actually get CE credit for the entire course as you learn. So it's like a 2-in-1 combo. Now, this new grad course is available by itself or as part of the Elite Learning Nursing Career Passport membership, where you can get access to even more new grad skill videos, live Q&A sessions with nursing experts like me, and a whole library of fun CEU content in convenient formats like podcasts and even videos to help you maintain your license. So what are you waiting for? You can find out more about this course and our resources for new grads in the career section of your Simple Nursing dashboard. I'll see you guys there.